Hi, I'm Dr. Heather Pranzerdi-Stratton at HPS Advanced Dental Care. We're located in Shelby Township, Michigan. We get a lot of questions from our patients about mercury-safe, mercury-free environments, how we are mercury-safe or mercury-free for the patients, for ourselves, and how we relate that to the overall environment. I know a lot of people are concerned, obviously, as we all are, about how the things that we do affect the environment. And one of the things that we have at our office is what we call an amalgam separator. Actually, in 2014, the state of Michigan has mandated that all dental offices have an amalgam separator on their water lines. We've had one for about 10 years now. So we were kind of ahead of the curve on getting that amalgam separator in the office. But that is that's absolutely a thing that we want to do to keep the environment safe. It's not keeping the patients in the chair particularly safe, but it's keeping all of us safe, just living and breathing and drinking the water in the Great Lakes and everywhere else. Basically what an amalgam separator does is once we use the suction, we get the mercury that goes down here, that goes into the water lines, it goes into the sewage and so on and so forth. So because of that, that was always just going directly into the water supply, was all that mercury that was being suctioned out of people's fillings. So many years ago, they came up with something called an amalgam separator. And what that does is that goes actually on our water lines, it's in our basement of our building, and so now it somehow it separates the amalgam from the rest of the water supply. We then have a big canister that we send to a hazardous waste place that disposes that safely for us. So that way none of that mercury is getting into our water lines. Luckily in 2014 now all dental offices need to have that on their water lines, so that's very, very good. But that is one way that we're keeping the environment safe, because that's obviously a concern with the mercury. We do many things to keep our patients safe while they're in the office and our staff safe and myself safe, so that we're not breathing in that mercury vapor as well. So we also try to maintain a mercury-free environment while we're all in the building, because I personally have a mercury sensitivity, and I'm sure a lot of other people do too, especially after working in dentistry for as many years as we've been working in dentistry for. So because of that, we know that mercury starts to accumulate into our bodies, and once we're exposed to that mercury, it stays there for about 20 years. So, if once you're exposed to mercury, we need to get it out in other ways, but that's why we want to make sure that we're all staying safe, and we have lots of ways that we do that here in the office. So if you have any questions, please give us a call at 248-652-0024.